your husband dey always go where dey soon?
You never hear.
Say wetin?
Now one ogbonge treatment don land for town for husband and wife dem wey one dey HIV positive. Dem dey call am pre-exposure prophylaxis PrEP.
Wetin that one come mean na?
Na the kind treatment wey doctor dey give husband and wife to make sure say the one wey get HIV no fit give the other one wey no get am. Even sef, the drug go mama the virus for the body of the one wey get am sotey doctor no go see HIV again for im blood.
And una no fit tell me, you know say me I dey positive and my husband no get am. We dey think how we go live our life wey my husband go dey kampe and we go get pikin wey no get HIV.
Help don dey. Go to any government hospital wey near you pass and dem go sama you with correct information.
But e go cost plenty money.
Shishi, you no go pay. In fact, husband and wife wey go be part of the study wey dem wan do for Jos, Nnewi and Calabar go get free testing and treatment for different kind yamayama infection, plus including medicine wey fit help in case dem ready to born now.
This one sweet my belle no be small o. Halele, I don go call my husband hospital with a go so.
Country people, this pre-exposure prophylaxis don work for many countries. Just green 08039654417 for more tori. This message now from National Agency for the Control of AIDS, NACA.
This is The Exposure, and you are welcome. The Exposure is a radio public enlightenment program supported by the National Agency for the Control of AIDS, NACA, in partnership with Bill and Melinda Gates Foundation on pre-exposure prophylaxis, PrEP for short. Pre-exposure prophylaxis PrEP is a deliberate effort to prevent an uninfected person or partner who is at risk of getting HIV from getting infected. For the past couple of weeks, we have been discussing pre-exposure prophylaxis, a formidable intervention put in place to check the spread of HIV, especially among discordant couples. We have told you that the project is currently going on in 3 sites in Jos, Plateau State, Calabar in Cross River State, and Nnewi in Anambra State. This study is to enable Nigeria sustain or ascertain which model will be cost-effective and promote easy access to the treatment. Each of these sites has what we call co-principal investigator, and of course, Dr. Tinuwade Oyebode is for the Jos University Teaching Hospital, which is the hub site for the project. And of course, we also have the opportunity of hosting Professor Solomon Sage, the principal investigator for the Jos site, and the team leader, of course, for the community engagement on PrEP project in Plateau State, Bali Namag. Also on this program, we had the opportunity of discussing with the study coordinator of PrEP project in Plateau State in the person of Mrs. Babalola Jacobs. It is The Exposure. I am Wika, your host. We shall be right back after this timeout. It is The Exposure, and once again, you are welcome. Like I said, pre-exposure prophylaxis PrEP is a deliberate effort to prevent an uninfected person or partner who is at risk of getting HIV from getting infected. Well, we have so far discussed what the PrEP project is all about, who needs PrEP, why the PrEP study or project, and benefits of PrEP to the couple. We have therefore brought key actors and personalities involved in the pre-exposure prophylaxis project to provide answers to these questions, among others. But of course, we have guests here in the studio who will be taking on issues, those who are actually involved in the various sites, like we were told last week by the study coordinator, Mrs. Babalola Jacobs. And as usual on this program, I'll allow my guests to interact with our listener back at home. I have actually 2 guests in the studio, a man and a woman, or a male or a female, like you said. But seated directly is, kindly introduce yourself, please.
I'm Dr. Jonathan Bulus, a consultant family physician and also a PIN coordinator for Plateau State Specialist Hospital.
Thank you so much for joining us on The Exposure. And by my left,
I'm Caroline Onwezobe. I'm a study nurse on the PrEP program. I work with Faith Alive Foundation. I'm the head of administration and programs, and also the site coordinator for PrEP, Faith Alive Foundation.
Okay, I will stay with you.
Okay.
What are your functions at the site?
Okay, our functions basically is to make sure we are part of the people or the organization where people come to access PrEP. We give mobilize people come, and then couples where one of them is positive and one is HIV negative. So they come in and they are screened and all the process, and PrEP is actually given in Faith Alive Foundation. So Faith Alive Foundation is one of the sites that you can come in if you are discordant and we'll begin to talk about PrEP.
Okay. Before we get into detail of how you've gone in that, I would like Dr. Jonathan to give us an insight on what is your connection with the PrEP project.
Okay, as a physician, we don't just test the clients. We also do a clinical examination before commencing drugs because we know some of the side effects of these drugs. So we don't just administer the drugs, we do a clinical examination first. From the history, we take a brief history from the patients or the clients, and also we do a thorough examination, and then we do laboratory investigations to be sure that the organs are perfectly working, especially the kidney, because the main route of excretion of these drugs is the kidney. So we want to be sure that the kidneys are perfect before we commence these drugs.
But why do you have to go through that process?
Yes, it's very, very important, because for someone who already has a kidney problem and you're giving him a drug that is excreted through the kidney, you are rather causing more harm to the person. And so we want to be sure that your kidneys are okay before we commence you on this drug, because the main route of excretion of this drug is through the kidney.
Is it that the drugs are toxic, or how?
Yes, for every drug you take, there are side effects of every drug. Even the paracetamol that we commonly take, there are side effects of these drugs. So the toxicity of these drugs, that's why we want to be sure that the kidney are working well. We want to have a baseline, because we want to have a starting point. We don't just start you on drugs and then later, if there's a problem, we don't have where to fall back on. We want to do a baseline test, do your renal assessment first. We have the baseline, then we commence you on these drugs, and then periodically, we don't just start giving the drug and then you just continue. Periodically, we examine, and then we do a laboratory test to be sure that the figures are still okay, within the normal range.
Okay, so but what's your experience like in the field, particularly at youth?
Okay, well, I work with Plateau State Specialist Hospital.
Okay.
Yes.
Okay.
The experience, well, in terms of response, people are responding, but the people still need more awareness, because we are looking at cost-effective way of managing HIV, especially in the age we're living in. This PrEP is something that in the Western world, developed nations have been far ahead of us.
Yeah, I had wanted to come to that.
Yes.
Where has it been practiced? Have it been used before?
In developed nations, they've been using this because they want to see that the new cases don't come in the society, because they are looking at, if we have new cases, that means the spread is going to increase. So these drugs are administered, but these are new things that we want to start in our own environment, so that we look at the cost effectiveness. Is it that we wait for somebody to get infected before we commence him? Is it more cost effective, or we prevent the person from getting that infection?
Just like the prevention, they say, is better than cure.
Yes.
Okay. But you did say we need more awareness in terms of turnout of people to access these services. But from the field, from Plateau Specialist Hospital, what is the rate of turnover for now?
Yes, for now, people are responding. People are turning over, because, before, the problem with HIV before now has been stigmatization.
Exactly, yeah.
And so people are now getting out of stigmatization, are beginning to face the reality, because as adults, when you have this problem, it's better handled than when you are now giving birth to children that are having this problem. And so people are now beginning to know that, that means there are drugs. Initially, people are looking at discrimination, people segregate, people differentiate and say, oh, you are infected, we don't want to associate with you. But people are now beginning to come up out of it, because they've now discovered that they've lost quite a number of people. So why should we also be part of those people that are going, when there are drugs we can take and then prolong our life and then add value to our society and also to our families?
Okay. I know there are about 7 sites in the state that this current project is going on. And like you said, you're from Feet Alive, which is one of those sites. Before now, was First Alive involved in PrEP, or this is the first time?
Okay, before now, First Alive is somehow involved in PrEP, but we don't give the medication.
Okay.
Because this is a special program. But First Alive, we've been seeing clients that are discordant, serodiscordant, where one is HIV positive and one is negative. Basically, what we do counseling.
Okay.
We tell them what to do, and but with the coming of PrEP, it's more prevention, more preventive, because PrEP, you have treatment as prevention, and also you are also giving the PrEP to prevent, because these people are already exposed, their partner is HIV positive. And so before the PrEP actually came in, the drugs, we see a lot of clients and we give them counseling, even some before they get married, if they're discordant. And sometimes we've seen people that say, no, they can't get married, it cannot happen. But we give them counseling and ask them, it's your choice, go and make a decision. But with the coming of PrEP, I think it's something that people should come out and assess.
Okay. You're at the site. What is the experience like? How has it been like since the inception of this project within your own site?
Wow, I think the experience is wonderful. People are coming out. We'll have a lot of people coming to say, hey, we've heard this thing, they're giving one medicine. What is it all about? Sometimes on the road, people that know you work there, and you begin to explain to them. I think people are becoming aware. And even as doctors have said, the issue of stigma is still there, but to some extent, the stigma is reducing. People can now come up openly and say, yes, we are discordant. And even we have people that have relatives, friends, that will come up to you and say, how can my relation, how can my friend assess this? So that means people are becoming open about it, that they'll be able to come, and then we'll give them the medications.
Well, I'm giving this question to both of you. I know because of the desire or the anxiousness for somebody to key into PrEP, probably he might decide to go alone and say, look, I need to enroll into the PrEP project. What is the experience like? Maybe I'll stay with you.
Yes, we've had people like that. They've come, sometimes the man or the woman, and some of them will say, no, the man is not ready to come, and this. We tell them, no. For PrEP to happen, it has to be a couple. First of all, we have to be sure of what we are doing. It has to be a couple. We have documentations, we have counseling, we have modules, we have things to follow. Because PrEP is different from PEP.
Okay, yeah, okay.
Yes, so we tell them there's a difference between PrEP and PEP. PEP, you already have the exposure, and you're not coming to prevent, but PrEP is something, it's there with you, so you need to do something. So we tell them no, we cancel them actually, but we encourage them. They have to come with their partner.
Okay.
Yes.
What is the experience like at your own name, Plateau Specialist Hospital?
Yeah, it's really interesting because it takes time. It needs continuous counseling, really, because we don't want to handle the individuals at their level. This is a couple thing. We want to be sure that there is harmony in the family, because when we take a single person and start, counseling a single person, we find it difficult to relate to the other person. Some people feel comfortable when it's the health personnel that is discussing with the two of them at the same point, rather than saying, oh, you go and discuss with the other partner. So it has been really challenging because you see people coming once in a while and say, oh, I'm finding it difficult to disclose to the other person. Please, can you help? So that is now the opportunity for us to now say, okay, let's invite the other person, and then we'll initiate the discussion so that the program will be sustained.
But why do you think the people adopt that initial, can I say, fear of coming together?
Yeah, the environment really is a contributing factor, because
that's it. That's what we want now.
For now, that is what we want, because nations have gone far. Why should we be behind? We need to key into this. Very, very important. It's cost effective.
You keep on mentioning cost effective. Can you elaborate on that?
Okay.
Yeah.
In terms of cost effectiveness, we are looking at a lot of things here, because one, for people that are already positive, it involves a lot of things. One, you look at the person individually, you look at the family, you look at the work environment, you look at the series of investigations that this person will need to do before, getting these services. But with PrEP, you only need to just be tested. When you are tested, you know that, okay, you're positive, your partner is negative, you now enroll into the program. The only thing we do your chest, and then we do your baseline test, your kidney, to be sure that they're perfectly working, because this drug is basically the kidney that is involved. And so we look at the cost. How much does it take to say, okay, let's wait for somebody to be infected first? The cost in terms of the drugs, in terms of the investigations that we need to run, and then how much does it cost to just do the PrEP? Right, okay. We look at it and we balance it and we say, well, it's better to go for PrEP.
Okay, but for Faith Alive and of course Plateau Special Hospital, do you actually give them the drugs at these sites?
Yes, we do.
The drugs are there.
Is that so?
It's there anytime.
They are free.
And it's free. The tests are free. Yes, we do.
Expatiate more. How free is free?
Free as in FREE, free. Yes, because this program, just like you said earlier, it has been sponsored by the Bill and Melinda Gates Foundation, and it's also from NACA. So they've made it possible that we have all these amenities. We have the drugs, we have the testing, the adherence, and then apart from even the PrEP, the program is an integrated program.
Okay.
You also talk about other things that will also benefit the family planning, other issues of at home. So I think it's a wonderful program, and I encourage people to come out, people who are discordant, come out and have this free gifts that have been given to us.
So just like she rightly said, these are free tests. So we are calling on all people. Let me also speak in Hausa a little. Muna kiran duka jama'a su fita domin muna gani cewa bai kamata wannan zamanin da muke ciki yara mu zo muna haife yara wanda suna da wannan matsala ba. Dole ne mu fita. In dai akwai a cikin iyali akwai mace ko miji wanda ɗaya na da kan jama'o ɗaya babu, sai a yi kokari a fita domin kada a zo a samu ƴaƴa wanda za su samu wannan matsala.
Thank you so much for bringing that the Hausa version. I hope that we have a Hausa edition for this program. And your last word?
Okay, my last word is I want to encourage couples to come out. All the sites that offer PrEP, they've been trained on confidentiality, on privacy, and like for Fit Life is we don't segregate. So please come and access this program. Don't die in silence. There's something to be done. Come there so that your partner that is negative will continue to be negative, and you continue to take care of your children and will live happily, and the country will be blessed.
Thank you so much for coming on the program. I hope that when we find time again, we'll call you, you come over to the program. But again, I must say that this is the final of the program. So I want to thank you so much for coming on the program.